Thank you, Rajiv. I really appreciate the opportunity to share with you what I feel is one of the major contributors to reducing stress and improving wellness, and that's volunteerism. So I'm going to talk for 6 minutes about why you should be a volunteer. And it turns out that scientific studies have been shown that when you volunteer, you expand your longevity and you improve your health. You actually measurably improve your health by volunteering. You can also expand your social network. When you volunteer somewhere, you meet new people, and you actually can learn new tricks, new trades, new things that you can do that you never thought you could do, and these help combat your own symptoms of depression. These strengthen your ties to your own community, and you have a sense of pride, a sense of accomplishment, a sense of identity by being part of something that's bigger than you. And it also, less altruistic, more realistic, it looks good on the resume. If you're ever being considered for a position, and it turns out that you volunteered at the, say, ASPCA, and somebody else has done only professional activities, you're going to be selected. It turns out that it broadens your horizons and broadens your resume. You can teach your children and the people around you by modeling volunteerism, by giving back to your own community, and it renews your own sense of community, which lets you know that you're never alone. It contributes to the future of medicine by volunteering to teach those that will come along, the future physicians, whether it's medical students or whether it's volunteering in the local high school to talk about what you like about your career. And basically it allows you to feel more valued about your own skill set, what you bring to the field. It feels good in your heart. That's the bottom line, is it feels good in your heart to be charitable. So those are the reasons, in a nutshell, this is a lightning round, those are the reasons, in a nutshell, why you should, everyone in this room should volunteer. But then you say to yourself, well, where do I start? What should I do? Volunteering could be as simple as offering to cover for somebody when they're on call and they look like they're having a hard time. You see somebody with a runny nose who's on call that night, offer to give them a couple hours. They can go home, catch a nap, and then come back. Just volunteer to cover somebody for a project or for a night on call. That's volunteering. More formally, you can volunteer to teach medical students or pre-meds, whether it's through your local high school or through one of the 2 colleges we have here in Sacramento, or just let youngsters, whether it's bring a kid to work day or letting somebody who shows an initiative shadow you in your office. You can provide medical services. You can use your own healthcare professionalism through the SPIRIT project, the Sacramento Physicians Initiative to Reach Out and Innovate and Teach. The SPIRIT project is through our own local medical society. Or you can choose to volunteer at any of the student-run health clinics in Sacramento, or just any free clinic in the city. You can counsel at a crisis center. You can provide health fair screenings or vaccinations. You can offer to be the EMT on the field for the youth athletics in your area, or you can just offer to assist with the medical needs at the end of a marathon or a local run. Separate from your own field in medicine, if you crochet, if you knit, if you do woodworking, if you're really good at car repair, then you can volunteer that to either teach it, or you can volunteer to give away the projects that you've created. And there's nothing like crocheting baby blankets and giving them to a local hospital, crocheting baby hats, doing woodworking and offering that chair that you made, or the guitar that you made for the silent auction at the SAC Gala at the end of the year. All of these are ideas where you can volunteer that don't even have to do with medicine. You can, if you're an artist, likewise, whether you sing, whether you dance, whether you create something palpable, to offer to raffle that away at an event such as this or at the Med Society, or if you have a musical talent, to offer to provide that talent at a lunchtime in the patio of your hospital, that's volunteering. If you have a level of expertise, if you have a knowledge base in some area, to offer to share that with your local medical board, the school board of your local community, or your church, to teach the children of your church, to teach the adults about something medical, to be the expert. Not only does that allow you to recognize your own strengths, but it also builds the esteem of the medical community. Generally, you hear people say that physicians and priests and nurses are the most trusted members of the community. That builds on itself when you, the physician, are the one talking to the Seroptimists, the Rotary Club, or your local school board. Separate from that, if you want to volunteer at an animal shelter, there's nothing like petting a dog to reduce your stress. So volunteering at a local animal shelter, volunteering to read to youngsters, volunteer at a hospice or a memory care place, you don't have to do anything. There, you can just sit next to somebody and you will make your life longer and you will make their life longer. You can become a docent at a museum or a zoo. There are literally thousands of ways that you can volunteer, and volunteering will extend your life and expand your health. So I urge you, for your own joy of medicine, to volunteer. Thank you.